breathiness. So by the end of the presentation, students should be able to identify what you would expect with somebody with the diagnosis of breathiness, therapy approaches to treat breathiness as an SLP, and how instrumentation can be used additionally in the treatment of clients with the diagnosis. So we had a 47-year-old woman with extreme breathiness. And what is breathiness? Breathiness is a disturbance in the laryngeal functioning, so the vocal folds don't adduct completely. And there's too much air loss during speech and singing. You have a quiet voice, and the speaker tends to run out of air when they're speaking. And there's 3 different levels. It's mild, moderate, and severe. So to understand what a breathy attack is, what I'm going to have you guys do is hold 2 fingers, one in front of your lips and one on your larynx. And you're going to say, he and I.
He and I.
So what did you notice happened first?
The
Breath, yeah, right. The breath comes out before the larynx vibrates. So that's frequently what happens during breathy attacks. The air comes out before the vibration occurs.
So depending on the individual, there could be different causes of breathiness. The vocal folds may not completely close, or it could be due to a lack of movement of one or both of the vocal folds, or the vocal folds could be malformed or the tissue changed. And then many different voice disorders have breathiness as a symptom. Some of them will be vocal fold nodules, polyps, cysts, paralysis, spasmodic dysphonia, granuloma, papilloma, and contact blisters. And so for our client who had extreme breathiness, you would specifically see weakness, failure of the folds to approximate appropriately, excessive loss of air when producing most voiceless consonants, especially plosives. So this further distorts the respiration and phrasing during continuous speech. They would aspirate before the initiating vowel. Pitch register would be moderately high and moderate pharyngeal resonance. And they'd often be able to not say more than one word at a time. Again, this is an example of extreme breathiness. It's like it's really hard to understand her.
So for treatment for breathiness, it's different depending on the case. A lot of times they'll need surgical intervention or voice exercises to restore and improve the voice and the muscles involved with the voice. And a lot of times an SLP will work with the client. So like any goal for any type of therapy, the goal for voice therapy is to rehabilitate the client's voice to a level where they're functioning in their environment and fulfilling their communication needs, to help the client produce the best possible pitch, loudness, and quality for their age and gender, to reduce or eliminate the voice disorder, and to prevent reoccurrence of the voice disorder. And then there's 2 different types. There's the symptomatic voice therapy, which you work directly on just one component of it, whether it's the pitch, the loudness, resonance, respiration. An example of that is respiratory retraining. And the physiologic holistic voice therapy is you're balancing 3 subsystems of the voice production at one time. So for example, you'd use the vocal function exercises, resonant voice therapy, and accent method of voice therapy. Okay, so this is our little example. This is our little example of what we did. Resonant voice therapy, it's kind of like a specific guideline of what you're supposed to follow. So it's just like the beginning part of it. Our objectives were for the client to obviously make the targeted voice quality. And then also in our lesson plan, you'll see it's for her to discriminate between a good voice quality or a breathy voice quality, but we didn't really do that there.
This is an example of resonant voice therapy. The client will first start off with stretches and vocal warm-ups to activate the muscles.
Okay, so what I want you to start with is some stretching. So I'm going to have you slowly roll your head forward until your chin is just touching your chest. And you go forward till your chin reaches your chest. Keep it there for a few seconds. And slowly raise your head up and backwards.
So now a lot of times like they'll
You
do
feel the stretching
stretching.
in the back.
exercises for about 5 minutes. Next, they will move on to produce simple repeated syllables at a comfortable pitch and speech range.
Okay, so you're gonna have you repeat after me, focusing on where the vibration occurs. Hum, hum. Okay, so when you did that, where did you feel the most vibration?
Next, they will move on to voice exercises at a comfortable pitch.
Okay, I'm gonna have you repeat after me again. You say me, 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 me. You say ma, 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 ma.
Have the client continue with voice exercises while changing the consonant vowel combinations. Next, they will work on producing voice sentences.
Okay. Now we're gonna do sentences. So can you say Mary made me mad? Okay, that was a little roughy, but we'll keep working on it and trying.
Continue each section until the
So
session
that's
is
just like a little sample of like what resonant voice therapy is.
So for clinical implications for this therapy, it's important to slow down the rate of speech because as breath is also being pushed out at a fast rate, it makes it harder to understand them. And a slow rate of speech and a reduced amount of airflow may produce clearer speech due to the increased resistance of the vocal folds. And we also want to strengthen the muscles of the vocal folds. By doing this, adduction is more likely to occur. And with increased adduction, there is decreased breathiness. So you want to practice with voice sounds, then words and sounding sentences. And it's good to start with vowels and then get more complex as you go.
Okay, so we also use Wave Surfer with the client. Wave Surfer is just going to be visual and it allows the client to see what they're producing. So you can go to the next one. So this is a waveform, and this top one is the ah sound. So this is the breathy voice versus the normal voice. And as you can see, there's less variation in the breathy voice than there is in the normal. And this is the same thing. It's actually this sound, or that word, this is a word, it's barred, I think it is, and that's barred as a normal voice. So there is a little bit less variation.